Happy holidays, everyone. It's DocTalk, probably for the last time of the year. We're heading into the holiday season. I am at a very busy fire station where today I can't even find a quiet place because there's so much activity going on here. We have a recruit class that is finishing up, people that are thrilled to be in our industry and to be able to serve. And they're taking up a good deal of the training yard here. So I kind of hid in the corner. This is good time to be talking about our plans going into 2022. So here we are. We have a new variant that is moving into the country and no doubt is well established here. The good news to date, we're a couple weeks into this now, is that we are not finding that Omicron is causing the same degree of high intensity illness that we had with the Delta variant. In this country right now, many of you are in areas where the Delta variant has taken off and is making people very ill, and we have deaths at the wrong time of the year. And the hospitals are busy. They're taking care of their usual year-end business and the seasonal stuff and have a lot of COVID patients on top of that. We're looking for recovery efforts with infusions and with good home care and the ability not to have this disease continue to propagate, whether it's in the Delta variant or the Omicron variant. But let's look a couple weeks ahead. Thanksgiving brought us a lot of contact with family and friends, and unfortunately a lot of spread of the coronavirus. We have that bolus now that's contained in our emergency systems and in our hospitals. That almost certainly will occur again over these holidays. So what I recommend to you is continued care in who you're around. The use of masks is still protective to you and to those around you in a social setting where you're around people that you don't know what their status is. Vaccinations, whether it's Omicron or Delta or any other variant, are still a great idea. And it is the original vaccination plus the additional vaccination. The word of this week is, for those of you that got Johnson & Johnson vaccines, is that the second dose that you get should be of one of the mRNA vaccines. So that's either the Moderna or the Pfizer. For those of you that got the Pfizer or Moderna in your first series, get a booster with either of those. The mRNAs match themselves really well. As of this week, because we have the mRNA vaccines, they've proven so safe and so effective, the CDC has kind of downplayed future dosing with the Johnson & Johnson vaccine, just so you're aware. Many of you got it, you did fine with it, it protected you. You're going to get another jab with one of the mRNAs, and you're up to full levels of protection. Many of you have been sick and had COVID already. Whether it was an alpha variant, beta variant, or the Delta variant, you got one of the illnesses. Our best information now is if you'll get vaccinated on top of that, you're in much better shape protecting yourself into the future. The news from the vaccine world is our vaccines are still very effective, and they're protecting us from severe illness, which is what they're supposed to do. I know many of you have gotten the vaccine and then gotten a mild illness, a mild form of COVID, and to all of us, that's just fine. That is then hybrid immunity for you. You didn't get really sick with it. You didn't go in the hospital. You didn't die. And that's what our vaccines are supposed to do for us. For many of us, and I'm included, I got my 2 original doses and then my 3rd dose about 3 weeks ago. And I have a high level of protection that I otherwise would not have had. And very frankly, by now, if I hadn't had my boosters, I had been exposed to so much coronavirus, I would no doubt have been sick now. And I'm one of those high-risk people that could have died as a result of coronavirus illness. So next year, so starting in January, we are likely to be back again in another increasing wave of coronavirus illness. It will be a combination of both Delta and Omicron by that time. To what we know, 3 or 4 weeks into this, Omicron is not causing as severe an illness. It is still not something that we want if we can avoid it. And at any point, Omicron can also begin to mutate and create more serious illness. That's why we don't want any more people having this virus reproducing in their little factories inside our bodies, creating more variants. So all of the science points us in infectious diseases to stopping the disease so that it doesn't create variants and doesn't get worse. So there's nothing like a good virus in your body. Vaccines always the way to protect people. And we protect, first of all, against high degree illness and then any illness at all. It is always better to protect and prevent rather than to try to treat. So vaccines still good. Vaccines still good even if you've had the illness already. And vaccines protecting our communities, resulting in fewer variants, is a great thing. All right, let's switch and talk to treatments. So we're at a period of time now where in many areas of the country, many people are undergoing treatment for their coronavirus disease. We are using two things now: monoclonal antibodies, and they have fancy scientific name, but the monoclonal antibodies are designed to rescue you once you have the disease. There is a second class of monoclonal antibodies coming out now, another big long name, that is designed as prevention for people at high risk who cannot get vaccinated. So you will hear about a version of monoclonal antibodies with a long name that protects people who are at high risk for COVID and can't get vaccinated. There's another group of therapies coming out now that are treatments. The first one has already received its emergency use authorization. That it was produced by the drug company Merck, and it provides some protection for people who already are sick with COVID from it getting worse. That's a 5-day treatment given orally. Unfortunately, as they have begun to use this drug, its effectiveness is down from what it showed in the original studies. There's a second type of oral treatment that is now before the FDA, looking for emergency use authorization, made by the drug company Pfizer. And that treatment has shown to date higher levels of effectiveness and the potential that it will also protect people who get the Omicron variant. That Pfizer pill has not been approved yet, is not available, but you will hear about it probably before I talk to you again in the next DocTalk. So I want you to be aware of it. What will we be doing in January? It is likely across many areas of the country that we'll be in another wave. We may be back in masks. We may be back in social distancing times again for one last attempt by the coronavirus to affect every person on the planet. That's the way it really is. And we believe that when we get into second quarter of 2022, that we will be beyond the significant waves of coronavirus. We will be having enough vaccinated people and people recovering from the infection that the coronavirus won't have a whole lot more places to go and try to find people. We are in the usual wintertime busy healthcare system, and it is possible by springtime that we will have made it through that wave. We'll begin to catch our breath a little bit in the healthcare system, and then begin to think about changing the healthcare system, how we deliver care. For those of you who are doing mobile integrated healthcare programs, you have a big year next year because we're going to be looking at mobile integrated healthcare and community paramedicine in whole new ways next year. And I'm thinking that the second quarter of next year, 2022, will be the time when we are looking at new designs for healthcare, new designs for emergency care, and ability to kind of rewrite how we deliver healthcare in this country. We can only wish for that in the new year, and we can only wish for no more variants and no serious variants coming out of what's existing here. And for all of those who died, we're over 800,000 Americans that have died at least of COVID already. We can work off of their deaths to create a much better health system and a way to protect ourselves from pandemics in the future. So enjoy your holiday, be really safe. Be safe in all of the typical holiday things that we do anyway. And unfortunately, this is the time of year when we're fighting fires and we're taking care of holiday related stuff. On top of that, we got to protect ourselves. So in communal areas, think about your masks, think about distancing. If Omicron proves to be even more transmissible, you're going to find yourself more comfortable in that protection. And let's make it through to a very successful 2022 and a whole new year to look forward to interacting with each other, getting back to concerts and churches and social events and sports and all of that. So I wish you all a very happy holiday, a great new year. DocTalk will be back in 2022, and I look forward to seeing all of you then. Thank you very much.